All right. Thank you for joining us today. I am Elise Salisbury, Director of Programming here at Sister Reach. Thanks for joining us for our Social Justice Preacher Series in collaboration with Black Mamas Matter Alliance for this week, Black Maternal Health Week. Sister Reach is a 501c3 organization based in the state of Tennessee, founded in 2011 by our CEO and founder, Sharice Scott. Sister Reach is a reproductive justice organization that supports reproductive autonomy of women and teens of color, poor and rural women, LGBTQIA people, and our families with the framework of reproductive justice. Our mission is to empower our base to lead healthy lives, raise healthy families, and live in healthy and sustainable communities. We achieve our work through a four-pronged strategy of education, policy and advocacy, cultural shift, and harm reduction. And our reach is local, regional, national, as well as international. We seek to increase awareness and impact our supporters through centering the voices, experiences, and leadership of those most marginalized, curating community-centered discussions and trainings to enhance and engage knowledge and base building among the people that we serve, and strategically engage stakeholders whose work aligns with our mission, our vision, and expands our capacity to reach our base and achieve human rights. Again, thank you for joining us for our Social Justice Preacher Series. Today, our guest is Dr. Nikia Grayson. Dr. Nikia Grayson is a staff nurse midwife at Choices Memphis Center for Reproductive Health. Before becoming a midwife, Dr. Nikia worked in public health, where she studied and developed community programs around HIV and reproductive health. While working on an infant mortality community project, Dr. Nikia saw a great need to address maternal and child health and decided to become a midwife. After graduating from nursing school, she worked as a labor and delivery nurse at Regional One Health. During her time working as a labor and delivery nurse, she completed her doctorate in nursing practice and family nurse practitioner education at the University of Tennessee. She then went on to complete a certified nurse midwifery postmaster certificate program at Frontier Nursing University. Dr. Nikia joined the staff at Choices in 2017 and is excited about changing, changing midwifery care to families in Memphis, Tennessee. Dr. Nikia has a deep and committed compassionate approach to the midwifery service and care that she offers, and continuing her work in reproductive health, reproductive justice, and birth justice is her goal. Dr. Nikia's goal is also to give her patients all the options available to them and to empower them in their ability to make medical decisions for themselves and their family. Please help me welcome Dr. Nikia Grayson, our Social Justice Preacher Series Doctor of the Month, as well as we celebrate Black Maternal Health Week.
Hey, Elise, how are you?
I'm great. Thanks for being here.
It's always good to see you. It's always good to be with Sister Reach.
Thank you.
So what are we talking about today? We're talking about Black maternal health, right?
Yes.
And so I'm going to talk about some of the historical aspects of Black maternal health, and specifically Black midwives. So whenever you're ready, Elise.
All right, go ahead.
Okay, so I'm going to share my screen. Okay. Welcome, everyone. I'm calling this presentation A Great Cloud of Witnesses, honoring the grand midwives and reclaiming our place, in honor of the speakers series being from the perspective of really faith, right? So let's talk about these amazing women. So I'll give you a little bit of background on me. So I am Nikia Grayson. I think it's not turned. There it is. Okay. I am the Chief Clinical Officer at Choices Center for Reproductive Health in Memphis, Tennessee. And I guess I'm the Chief Clinical Officer of our other clinic too in Carbondale, Illinois. I'm honored to work with such amazing people here at this Reproductive Healthcare Center. I am a graduate of Howard University twice. I am a graduate of University of Memphis with a Master in Anthropology, and a graduate of University of Tennessee Health Science Center with a Master's of Science and a doctorate in nursing practice. And I am a midwife. I'm a proud midwife. I'm a proud midwife here in Memphis, and I'm a proud Black midwife. So this week is Black Maternal Health Week. And Black Maternal Health Week is every year, April 11th through the 17th. But this year's theme is Our Bodies Belong to Us, Restoring Black Autonomy and Joy. And so in light of all that we know about Black maternal health and the rising numbers of Black women or Black birthing people who suffer from high rates of mortality and morbidity in this country, that has definitely been exacerbated by the pandemic. And we know that we've heard the stories, we've heard the numbers, but we also want to talk about the history, and we also want to focus on Black midwifery and Black-led doula care, as well as solutions for our community. And so Choices in our model and the midwives at Choices are working to be a solution for Black maternal health in our community. If you don't know us, please check us out. We have a group of amazing Black midwives and Black doulas and Black birth workers who work here at this amazing center in Memphis, Tennessee. Like I said, this Black Maternal Health Week is held annually, and it is a week-long campaign that has been founded by Black Mamas Matter Alliance to bring awareness, activism, and community building, and to amplify the voices, perspectives, and lived experiences of Black mamas and birthing people. This week is intentionally held during National Minority Health Month and begins April 11th annually. So join me and many others who are planning activities and hosting conversations to further reproductive justice, birth justice, and to bring awareness to our communities. So, title of my presentation is called The Great Cloud of Witnesses. So these amazing women, these amazing midwives are part of that great cloud. Hebrews 12:1 says, therefore, since we are surrounded by such a great cloud of witnesses, let us throw off everything that hinders and the sin that so easily entangles, and let us run with perseverance the race marked out for us. So today, we're going to talk about the ancestors, the great cloud of witnesses that are the grand midwives who have gone before us. They're these faithful women who have paved the way for us in our communities and paved the way for Black midwives today. Let us call their names: Biddy Mason, Beatrice Borders, Mary Frances Hill Colley, Margaret Charles Smith, Maud Collin, Mary Jane Trust Lawson, and Oni Lee Logan, just to name a few. And know that we are inspired by these grand midwives, and we are encouraged by their faithfulness and dedication to their communities as we continue to carry on their work. So, the history of midwifery in the United States. We know that midwifery has been a tradition that has been passed down from mothers, aunts, sisters, and grandmothers, and that Black midwifery has a legacy that goes back to African and Caribbean roots. The history of Black midwifery in the South, of course, begins with the grand midwives. These midwives were generally well-respected, highly esteemed older women who were first transported from Africa to the Americas on slave ships in the 17th century. They attended to other slaves and plantation mistresses in birth, women care and healing practices in the 20th century. We know that during slavery, midwives helped in the building of communities by caring for and supporting women through pregnancy and during childbirth. The midwives also acted as community healers, providing care, nurturance, and empowerment to children, women, and families. However, as the business of medicine grew in the 1800s, physicians began to become more interested in childbirth. But for Black women, the majority of births continued to be attended to by midwives. And after emancipation, grand midwives, along with other midwives of color and European immigrant midwives, remained primarily in the South. And in the early 1900s, close to 50% of births were attended by midwives, with a much higher percentage of Black births attended by Black midwives. And this was because physicians attended births were primarily to middle class and upper class white women. So in 1911, there became this campaign, or really it was earlier than this, but this campaign against what they called the midwife problem. So physicians began to have an interest in childbirth. And this quote is from Dr. Darlington, the Commissioner of Health in New York City in 1911, where he talks about this midwife problem, and where he says, we know in general that the midwife is commonly employed in this country by the Negro and alien populations, as well as the many native-born of foreign parentage. He reports upon midwifery investigations made in several of our large cities, together with observations from those who confront the problem in the rural districts, prove conclusively that the midwife, with very few exceptions, the country over, is dirty, ignorant, and totally unfit to discharge the duties for which she assumes. And these women attend approximately 50% of births. So in the 1920s, there began a public health solution to this midwife problem. The campaign to rid communities of Black midwives was steeped in racism and misogyny, and calling the immigrant and grand midwives uneducated, dirty, poor, feeble, and evil, and the use of fear to make people believe that midwives were the cause of infant deaths. When we really know that it was a poorly trained physicians that actually contribute to a lot of the maternal infant mortality issues that we were seeing in that time. So of course, this severely hurt marginalizing poor communities, leaving them with no access to care. And let me go on to say that these midwives, these grand midwives, were the original reproductive justice workers, right? They were the ones who recognized that families should be able to choose when they have children, and wanted to help them to raise them in healthy communities. So midwives were not just, the grand midwives were not just people who cared for them while they were pregnant to continue pregnancies, but they also helped them in terms of ending pregnancies as well. So the Shepherd-Towner Maternity and Infant Protection Act of 1921 was a federal funded act that was meant to improve maternity and childcare. But this act required midwives to be formally supervised, trained, and evaluated by public health nurses. And nurses inspected the midwives' bags to ensure that they contained only the supplies that were legislated by the health department, and not substances they considered contraband, such as herbs and roots and homemade salves. And failure to maintain an appropriate midwifery bag or attend a monthly training often resulted in a rejection of their licensure for renewal. But it was also in the 1920s that nurse midwifery was also being established in response to the maternal and infant mortality crisis. And following the model of nurse midwifery in Europe, early nurse midwives reportedly worked alongside public health nurses, and they were funded by this Shepherd-Towner Act. But this was also the start of the frontier nursing service that marks the early beginnings of a divided midwifery community, where there were primarily white nurse midwives and primarily Black lay or grand midwives. And though these trainings were actually not the primary emphasis of the Shepherd-Towner Act, training and evaluation fundamentally shifted how midwifery was practiced in the United States. And so by 1935, midwives attended only about 10% of all US births. And the practice of midwifery was still largely concentrated in the rural South, where the number of Black residents exceeded the number of white residents, and where, because of segregation, Black families were not allowed to have their births attended to by white physicians. So they still were seeking out midwifery care. So nurse midwifery became the focus to replace lay midwives. And one of the things that I wanted to point out was that this was also the start of the medicalization of childbirth, but also in 1941, Tuskegee School of Nursing opened the first Black nurse midwifery school. The main goal was to decrease maternal and infant mortality rates in the Southern Black communities. This school closed 5 years later in 1946, and it graduated 31 Black nurse midwives. By the 1960s, there were fewer than 70 nurse midwives in practice in the United States. And this is also when we started to see this resurgence of the home birth movement. But also in 1976, Alabama passed a law that outlawed midwifery. So approximately 150 Black traditional midwives were told they would be jailed if they continued to work as midwives. So of course, we know that by this time, by the 1950s and 60s, most of the births have moved into the hospitals. With this shift, women arguably became disempowered patients, the passive recipients of the latest in medical care. The focus was on management of pregnancy, monitoring the fetus, and really saw pregnancy as pathological. Their role as engaged decision makers in their own healthcare and how, where, and with whom they delivered disappeared almost entirely. But then late in the 60s and 70s, there was this explosion in the interest and growth of midwifery. But this new movement of self-taught, mostly white women, created a pathway into home birth and empowerment. But this new midwifery empowerment was virtually white and was unavailable to Black women and their families. Now, if you know Shafia Monroe, Mama Shafia, as many call her, she said one of the darkest moments in US history was the systemic eradication of the African-American midwife from her community, resulting in a legacy of birth injustices. And she's right, it was. And so here we are today. And where are we with midwifery and Black maternal health today? Well, we know that today we are seeing a rebirth of midwifery. We are seeing more midwives in our community. We're seeing more patients demand midwifery care. According to ACNM and NARM, there are approximately 15,000 midwives in the United States. But unfortunately, very few of them identify as women of color and very few identify as Black. According to American College of Nurse Midwives, only 976 identify as Black in our country today. And so we know that for nurse midwifery is legal in all 50 states, but not all midwifery is legal in all 50 states. And so this is problematic for people who want to choose different pathways to midwifery or also want to choose different care providers. And so one of the things also about nurse midwifery is that we can practice, like I said, in all 50 states, but that we also do family planning and well-person visits and gynecological care and transgender care, and we can also provide abortion care. Of course, we already know this. This is the reason we have a Black Maternal Health Week. We know that Black birthing people are subject to more complications and morbidity and mortality than their white counterparts. We know that our Black babies are dying at a higher rate than white babies. And we know that education and income does not protect us from these factors. We also know that racism and bias contribute to these poor health outcomes, and also a lack of access to culturally congruent healthcare providers. So with all that said, we know that racism is the issue, not race. Being Black and Blackness is not pathological. The system needs to be fixed. And so how can we fix it? So according to Dr. Saraswati Vedam, she says integrating midwives into our care models, into our maternal health care in our country leads to better outcomes, which we already knew that, right? We knew that access to midwives will increase more birthing options, family planning and gynecological care, that midwives have higher rates of vaginal births, higher rates of breastfeeding, and lower rates of cesarean sections. We also know that midwives have higher rates of vaginal births after cesareans, and that having a midwife decreases the rate of obstetrical interventions and reduces preterm birth weight, low birth weight, and neonatal death. So, what is reproductive justice? And this is really important because, to me, the grand midwives operated from this model as well. And so what I see us doing now is restoring and reclaiming our place as reproductive justice leaders, midwifery leaders, and care providers in our communities. So we know that one way to improve access is to adopt a reproductive justice framework, which is focused on advocating for the right to have children, the right to not have children, and the right to raise them how they see fit. So midwifery is a tool of reproductive justice because it is a political act meant to provide a service to not only protect women's agency and dignity, but most specifically a racial justice in the context of pregnancy and reproductive health care. Reproductive justice addresses the social reality of inequality, specifically the inequality of opportunities that women, especially women of color, have to control their reproductive freedom. It gives us options for making choices that are safe, affordable, and accessible. So Loretta Ross said, "We believe that the ability of any woman to determine her own reproductive destiny is directly linked to the conditions in her community. And these conditions are not just a matter of individual choice and access." So does midwifery align with reproductive justice? Absolutely. Absolutely. According to ACNM's position statement on reproductive health choices, every woman has the right to make reproductive health choices that meet their individual needs. Every woman has the right to access factual, evidence-based, unbiased information about available reproductive health choices in order to make an informed decision. And women with limited means should have available financial resources to support access to services to meet their reproductive health care needs. And I can gladly say that is what we are doing here at Choices. We are doing those things. We are helping people to have the families that they want, when they want, and how they want. We are an amazing midwifery team that is restoring midwifery in the South and reimagining how care can be. So Choices is using the reproductive justice lens to address the inequities and barriers that are issues for marginalized people to access prenatal care and birth services. You see, we recognize the same barriers our community was having in accessing abortion care were the same barriers they were having in accessing high quality, judgment-free birth options. We recognize that economic inequality plays a huge role in a person's being able to make the choices about abortion and birth. And our goal is to expand reproductive freedom, especially for those who have experienced reproductive oppression. Historically, women of color have had their bodies violated, disrespected, and disregarded. And meeting people physically where they are, taking Medicaid, educating patients, and providing them with information so that they can use their own power. This is what I believe our ancestors would want us to do. This is what I believe this great cloud of witnesses is cheering us on until to the end. We are their greatest dream. But Choices is not the only one in the community doing this amazing work. There are a few other amazing midwifery practices that I would like to highlight. One being Community of Hope, run by Ebony Marcel in Washington, D.C. This is the only freestanding birth center in Washington, D.C. And it is one of 4 federally qualified health center birth centers in the country. Community of Hope is bringing hope to the community, as well as everything from prenatal care to birthing services to tips on how to breastfeed. Community of Hope provides a safe haven for women and their children to learn about pregnancy, motherhood, childbirth, and children's health. And then there's the amazing team at Birth Detroit. The Birth Detroit embraces a community organizing approach to birth center development. They're rooted in deep equity and meaningful partnerships. The mission of Birth Detroit is to midwife safely, but to provide quality, loving care through pregnancy, birth, and beyond. They are a team of birth workers, birth advocates, and public health leaders who are working together to open Detroit's first freestanding birth center. The beloved Birth Black Centering Group out of Alameda Health Care Center in California is an innovative new group perinatal care program, and it's designed to provide care by, for, and with Black people, delivering holistic, culturally attuned, and racially concordant care rooted in health equity and birth justice. The midwifery-led team-based model honors and celebrates Black birth and community while addressing the crisis of racism-based disparities in birth outcomes experienced by Black birthing people. It aims to uplift the voices of Black women and provide a gold package of care that enables them to thrive in birth and beyond. And then there's Melanated Midwives, run by Carrie Stewart. Melanated Midwives' mission is to diversify the midwifery profession and empower Black birth parents with resources and tools to successfully navigate their prenatal and postpartum care. Melanated Midwives is actively engaged in addressing the maternal health deficit in Black maternal mortality and morbidity rates on the South Side of Chicago by bringing together Black mothers, pregnant people, politicians, public health workers, and community activists. And Melanated Midwives gives scholarships to Black midwifery students every year. They give a scholarship of $5,000 to help them to continue their education or to meet whatever needs that they may have. So as you see, these amazing Black midwives are carrying on the traditions and the legacy of the grand midwives that have gone before us. We are taking our place back in our communities, reclaiming our voice, reclaiming our space, and restoring Black midwifery to our communities. We are our ancestors' wildest dreams. Elise.
Yeah, awesome. Thank you so much. That was great. It's amazing to see, that we went from 50%, right, to 10%, and then today we're down to 4% of women of color representation among midwives in the entire country. So that's a huge drop.
And these were our traditions. These were our
exactly.
Yeah, absolutely.
Yeah, so I have one question from the comment section, then I have a few others. But Claire asks, does the fact that midwifery is legal mean that women can demand to have their midwife present at a traditional hospital?
Yeah, that's a good question. Midwifery is legal, but there are still legal barriers that midwives face in order to practice. So I'll use Memphis as an example. There's only one hospital here that credentials midwives, and they only credential the midwives that work at their hospital. So a community-based practice like ours cannot get credentialed any of the hospitals in the city, and none of the other hospitals in the city recognize midwifery. So while midwifery is legal in the state of Tennessee, there's still many barriers that midwives face in order to be able to practice. And that really is pervasive throughout the South.
So what, if anything, can those who desire midwives who may not be of a particular hospital staff, what can they or we do as a community who supports midwifery and midwives? What can we do to help change that? Because it sounds very limiting. Even if we consider the Black women and individuals of color of birthing people in the city alone, like no one entity can hold that number if there's a decent number of folks within the community who wants these services again. So what can we do to help?
Yeah, that's a good question. First of all, many want these services. We have a waiting list of people who want to get into care, but we are limited in how many people we can take. It went from, me being one nurse midwife to now being 6 amazing nurse midwives here at Choices. And I'm happy every day I walk in the building and see them. But what we can do and what the community can do is really lobby their elected officials. They have to change the law to allow us to be able to practice to our full scope. And as long as we are still have these limitations, it will always be hard for us to practice in our communities. But here at Choices, we're just pushing through and doing what we can, and we will continue to do that.
Awesome, awesome. So I'm going to ask this question from the perspective of a person who knows nothing about midwifery. So when considering if I was pregnant, right, do I have to go through a traditional doctor's office, or can I come right to you if I choose your services, or any particular midwife in the city or state? Like, how does that work in Tennessee?
Yes. Midwives are primary care providers, so you don't have to go through a physician. They can be your provider all the way through your pregnancy. Yep.
Wow, that's awesome. I didn't know that. Thank you. Let's see if there are any other questions. What is the difference? Victor is asking, what's the difference between a midwife and a doula? And do doulas share the same heritage?
That's a good question. A midwife is, well, let me start with a doula. A doula is a support person. Doula is, they're amazing. They're definitely needed as part of the care team, but they are trying to provide emotional support, and many of them do childbirth education and also lactation support and counseling. A midwife is a clinician. So we are able to prescribe meds, we diagnose, and we catch, or what you all would call deliver babies. So our scope of practice is different. A midwife, also, if you are a nurse midwife, you're on par to be considered a nurse practitioner, because the education is the same. And so we're all called advanced practice nurses. So so a midwife is different from a doula in that, like I said, we can diagnose, we can provide prenatal care, we can do family planning, we can do GYN care, we do many different things, whereas a doula is more of a support person. And there are different types of doulas. There are labor doulas, there are postpartum doulas, there are abortion doulas. And so they provide a lot more emotional support and education.
Awesome, thank you. So in the state of Tennessee specifically, and maybe you can even give this information from across the states, I would imagine, how bad is the infant mortality rate in communities of color, and how critical, we're only 4% of midwives across the United States, but how critical is the need for midwives in the state of Tennessee? We can start there.
Yeah, I mean, well, there's a critical need for midwives nationwide, right? But we also are really working hard to provide some diversity to midwifery. Like I said, there are only 976 Black midwives in the United States, and that doesn't necessarily mean that all of them are practicing. That just means that there are 976 licensed nurse midwives or certified midwives in the United States. So there is a great need to grow the number of midwives in our community. We know that culturally congruent care is important, and and representation matters. And so we don't have a large representation in our community. There are states that are more favorable toward midwives. There are states where midwives are able to practice to their full scope and practice independently. And we know that those outcomes in those states have actually been better than the outcomes in states that limit midwifery practice.
Sure. Last question. For those who might be interested in a profession, midwifery isn't something that we see commercials on, about during the day. So how would one become a midwife today?
Yeah, that's a good question. First of all, you're right. And I was reading a study that Dr. Alexis Dunn, who is our midwifery director here, is working on, and it said that the median age for midwives was 41. I almost fell out of my chair, right? So a lot of people are coming to midwifery late or as a second career because they don't know that it is an option, right? And so we really need to do more to engage our young people in helping them recognize this is a pathway for them, a pathway where they can, really impact their communities. And so we have to really reach them when they're in, grade school and high school, and really start attending these health fairs and things like that for them to know that it is an option. But there are more than one pathway to midwifery. There are some midwives who are certified professional midwives which specialize in home birth, and they have a pathway that can either be an apprenticeship type pathway, or they can go to school at a MEEC accredited school. And then they sit for a test called NARM, and they can become a certified professional midwife, or you can become a nurse midwife. Presently, like I said, here at Choices, we have 6 nurse midwives, and all of us went to nursing school first. And so we have a nursing education, and to become a midwife, you have to go to graduate school. So you either will get a master's of science in nursing, or you'll get a doctorate in nurse practice. But yeah, they're all needed though, whether you're a certified professional midwife or certified nurse midwife or traditional midwife, all of those are needed in our community to really address the ills that our community is facing.
Sure. Thank you so much for your time. It was an amazing presentation. Definitely always great to see and to know and learn about our history and how we got here. And so, thank you again. You have an event tonight for Black Maternal Health Week. Can you tell us about that?
Yeah, so we're doing a film screening of the film Birthing Justice here in our building at 1203 Poplar. And I think it's at 5:30. Yeah. And Sharice, who is founder and CEO of Sister Reach, she will be here to also talk about the implications of reproductive justice and the film. And so we're really excited about it. Like I said, this is the 6th annual Black Maternal Health Week. And each year it just warms my heart to see us deliberately focus on Black birthing people and Black women. So it's really important.
Awesome. Can't wait to see you there. Can't wait to see the movie that you're going to show, as well as hear the conversation that'll happen afterwards. Absolutely. Thank you so much for joining us. Thank you for all the hard work you do, not just in Tennessee, but across the states, across the world at this point, for everyone, basically, for everyone. So thank you again. Thank you for
I'm trying to do my part.
Oh my gosh.
That great cloud of witnesses proud of me.
Indeed. Listen, I'm sure they're applauding every day because you work so hard. Thank you so much. We appreciate it. We appreciate the work that you all do at Choices. And so, yeah, we'll see those who will be there tonight at 5:30 at Choices for the showing as well as a conversation. Thank you again, Dr. Nikia Grayson. We appreciate you. Join us next month for the Social Justice Preacher Series, who our guest will be Bishop Yvette Flunder for that one. Thank you again. You all have a great day.
You too. Take care.
Thank you.